Welcome back to another episode of Sage Connections. Today I'm joined by Madelyn Mans, an acupuncturist who specializes in fertility, pregnancy, and postpartum care. Madelyn brings a beautifully grounded approach rooted in traditional Chinese medicine, helping women regulate their cycles, prepare their bodies for conception, and feel supported throughout pregnancy and the fourth trimester. I'm so excited to dive into this conversation and explore how acupuncture can ease symptoms, improve fertility, prepare the body for birth, and nourish the healing process after delivery. Enjoy. So, can you share a little bit about your background and what drew you to acupuncture specifically and working with fertility, pregnancy, and postpartum clients?
What started me on my wellness journey and on my acupuncture journey is I was a patient first. So in my teenage years, I was growing up in the Plymouth area, and I was just a typical teenage kid trying to make college decisions, and I was so stressed out. And instead of turning to like a typical pharmaceutical care, my parents were like, let's try acupuncture. Let's try anything that isn't just, the average route for people who are struggling with anxiety about life decisions. So started with some acupuncture and immediately loved it and never had to touch a pharmaceutical for anxiety or anything related, which was such a miracle to me. So I went to school and I had no intention of studying acupuncture at first, but I just fell in love with it. And I would go home and get my treatment, and I'd go home and I'd study all about what just happened. So I just felt a strong calling to practice this medicine. I was like, if I can do this for the rest of my life and love what I do, I think I've won. So I decided to pursue the field. And then it just naturally felt like I wanted to pursue a more specified field with women's health, postpartum, pregnancy, and like fertility care. It just felt really natural. I loved working with that population. And who knows, maybe it's just because I'm a woman, but it feels like something I really like population I really wanted to help out.
Wonderful. So, in traditional Chinese medicine, I know that pregnancy and postpartum are seen as very special times in a woman's life. Can you explain how traditional Chinese medicine views this period and what makes it unique from that perspective?
Yeah, so I would say that Chinese medicine has such a different view than Western medicine on pregnancy, postpartum, and fertility in general. It's more than just a physical shift, it's this energetic shift that happens in the body. We can look at it from a few things. So, a few things are happening during pregnancy. So, once conception happens, we start to notice that one, we stop menses. That's something Western medicine notes too. But in Chinese medicine, we see that causes more liver qi stagnation. So, in Chinese medicine, menses helps us to keep things constantly flowing. It's important. But when it stops, we start to notice qi stagnates, not just because of the stop of menses, but also obstruction by the fetus. So, with that happening, we start to notice people having different symptoms such as irritability, emotional changes, sleep issues, things like that. So, that's one. Another thing is we start to notice that women are sharing their fluid, they're sharing their blood, they're sharing their energy with another life. So, during that time, we really need to nourish not just the child, but the mother, because the mother's sharing everything in her. We start to see blood start to increase in the body, and this Western medicine notes as well. Chinese medicine just talked about it really early on. So, blood starts to increase in the body, and we see that as we grow a placenta full of vessels, um, blood volume starts to increase in a woman's body. Same thing Chinese medicine notes. So, yeah, we really, really focus on care of the mother during this time. And then postpartum's no exception. I think something that Asian culture and traditional Chinese medicine does really well is they focus on the mother after birth. I think in Western culture, a lot of times what we do is we just send the mother out with a newborn fetus and say, okay, you're on your own, take care of this kid now. It's all up to you. And in Chinese culture, that's really not, it's way more community based and way more care of the mother. So I think traditional Chinese medicine really focuses on the health related to the mother in both pregnancy and postpartum.
I think that's a great point. I don't think it's just Chinese culture, though. I think it's
Yeah.
really in most other places around the world, aside from here. You
Yeah.
know, and we kind of talked about this when we met, but um, we grew. as humans, through most of our history, we were giving birth in the family, right? Maybe there was a midwife for the village or something, but in general, you had your mom there and your grandmas and your cousins and your aunts. And on top of that, you kind of saw that you saw pregnancy, you saw birth throughout your whole life. You held a baby when you were little
Yes.
and you babysat. And then that postpartum care was also there when the whole family came together to make sure that the mom rested for, the first, let's say, 6 weeks to just, throw out that number. But I think it's 6 weeks to 3 months. It's something like that, right? Where it's
Have you heard of the confinement period? It's something.
no.
So this is another really interesting thing. Chinese medicine speaks a lot about it. It's more common in Asian cultures, but I'm starting to see like here and there people talking about it in America, but it's 30 to 90-day confinement period that a lot of mothers will go through when they're confined to the bed, the house surrounding the bed, and members of the community, their family members, a lot of mother-in-laws will come in and take care of the mother, the new baby, children, or people in the home. Sometimes they'll hire help in, but a lot of times it's your own community. So they'll come in and make sure the mother's nourished, eating proper foods, a lot of times focused on like Chinese herbs mixed in with like congee soups, broths. They really want the mother to stay warm, try to rebuild all those substances or what we talk about, like fluids, yin, qi, blood, yang, lost during childbirth and growing a fetus. So it's really interesting to see that and now start to see it show up in the US a little. And I'm like, yes, this is great. Like, let's keep this up. So
Yeah.
I think that's awesome, especially because I think people are more open to talking about postpartum depression and anxiety and OCD and things going on there. And I think it's been going on for a while, but we never have really taken care of the mother after birth. It's like I said, it's always been like, let's go take care of the kid now. So hopefully, seeing more care for the mother, we can start to treat this as well.
Especially since maternity care periods very much, differ from company to company. And I'm hoping that in the future, more and more companies will go into the kind of the 3 month period.
Completely. And I know we talked about this book, but there was a book called Hunt, Gather, Parent, and it's a great book. But yeah, it talks a lot about like the family being there for the new mother, like parents coming in to taking care of the kid and being there to make food. And I think that's really beautiful too. So it's not just a cultural change with businesses, but also like the family unit, the nuclear family.
Awesome. So, from your perspective, how does acupuncture complement other prenatal care,
Yeah.
including, pelvic floor physical therapy?
Yes.
Just had
So
to throw myself in there.
yeah, I am the biggest advocate for integrative care. It's just really important. My favorite saying is if there are 10 holes in your roof, you can't just patch one and expect your house to stop flooding. You have to patch all 10. So this is exactly what we see with integrative care. Acupuncture is one hole, but mental health is another, and focusing on pelvic floor PT is another, and new adequate nutrition is another, and management is another. So we really need to patch all those holes to stop the flood. And this is how I view integrative care. So we can look at it as like a pelvic floor and acupuncture. Let's look at it as a little case study. So we have a patient going through some pelvic floor dysfunction where you might go with some exercises, some internal manipulation. I might look at it from like a nervous system perspective. And those two things can get to the same root and treat the same symptom. Just a different approach, but they're both needed because without one, we can't really get all the way there.
Yeah.
That
And
kind
I'm sorry, go ahead.
Oh, I was going to say, is that kind of what you see with your care and how you approach integrative care as well?
Absolutely, yeah. And throughout all of pregnancy, right?
Yeah,
So in the beginning, there might be more nausea, and like you were talking about from your perspective, there could be some energetic imbalance or stagnation. But then when you move through the pregnancy, each phase, each trimester is its own special
totally.
period. And then by the time people get to the very end, and they're coming into my office saying, "Can you just do something to get this baby out?" And I can't. For those wondering, I cannot.
Yeah.
But, is there, so when we're talking about kind of labor preparation and things like that, is there something that acupuncture and Chinese medicine can do to support that?
Yeah, definitely. So I like what you just said. Like, I can't push the baby out for you, but and similar in Chinese medicine, we can't force your body to do anything it's not ready to do. So if you, and I mean, this has been actually shown in a lot of more modern research about like, can acupuncture cause preterm labor or things like that? Acupuncture is a very safe modality. So really, we can't do that, but we can prepare the body for labor. So a lot of times what we'll see is if we look at this from a Western medical perspective, the body starts to release with the help of acupuncture different neurotransmitters as well as different endorphins, which help to reduce pain and the neurotransmitters, which help to encourage labor. So oftentimes when we use acupuncture integrative with other care, we can see acupuncture be really helpful in labor preparation. I see you're right. Like a lot of mothers, we kind of walk them through three different stages of pregnancy. The first trimester in Chinese medicine is really about this nourishment period. And we then go into the second trimester of pregnancy, which is about this growth period and strengthening period. And then we go into the third trimester, and it's a lot about like, let's get the ball rolling. And mothers are usually coming in and they're like, okay, I'm ready now. I'm ready today. And we're still trying to build you up at that point, but we want to prep your body as well. So we do some acupuncture treatments that are specifically designed to help prepare the body to go naturally into labor. We will talk a lot about like ripening the cervix and things like that.
Okay, interesting.
Yeah.
Okay. So then, okay, we have the baby,
Yeah.
and postpartum is often called the fourth trimester. So how does Chinese medicine approach that stage of healing, nourishment, and recovery?
Yeah, and that kind of goes back to really what Chinese medicine and Chinese culture have talked about is that confinement period. This is a time to rest and recover. Your body in Chinese medicine perspective, and sometimes in Western too, has lost blood, it's lost qi, it's lost yang. We've started to open things up and move things in different ways than they've never moved before. So we have something called the wrapping vessel or the daimai, and that wraps us all in. That's been stretched out. So we have to let our body come back into its own at this point. So a lot of times what we do in Chinese medicine is nourishment. It's all about nourishment, to nourish the blood, to nourish qi, to nourish yang, and then to just let the mother have some stress management. I mean, there is a lot of new changes going on in their environment and then also with their body. So if we can be something that gives them those moments of relief on a daily basis, that's all we want to do.
Awesome. And a lot of people are curious about safety during pregnancy. Can you talk about how acupuncture is adapted for pregnancy and why it's considered safe when obviously performed by a trained practitioner?
Yes, that's one of the most common questions I get, pregnant or not. A lot of patients will ask about the safety of acupuncture, and what I always say is when it's practiced by a trained, licensed professional, it's generally very safe. I will say in Chinese medicine, traditionally we have certain points called the forbidden points, and these are points that shouldn't be used on pregnant patients, which is very interesting. Points like Li4, which is right in this area, or spleen 6, or gallbladder 21, right up here. These are generally considered more moving points, more down-bearing points, so it directs energy down. And we don't want to use those during pregnancy. More modern research has shown, even with high stimulation of these points, it really won't force miscarriage or preterm labor or anything like that, which is beautiful. But being acupuncturists who respect the medicine and respect the tradition, oftentimes practitioners choose not to use those points, even though more modern research shows that they really can't cause any sort of harm to the mother or fetus.
Yeah, it's interesting because I practice something called dry needling, which a
Yeah.
lot of people ask if that's acupuncture. It is not acupuncture.
Yeah.
We come from very different philosophies, where dry needling is more for trigger point release, sort of muscle release. And there is sort of talk about whether or not that's safe during pregnancy. And for us, it's kind of similar in the sense that, we were when I was trained, if you were pregnant, no go for dry needling.
Yeah.
I think some more recent research is it's still kind of debatable. I typically don't dry needle pregnant women, but some are saying that if the muscles that you're dry needling are sort of further away from the thorax,
Yeah.
more distal, as we like to say, then it's more safe. But you don't want to dry needle anything that's kind of close to baby.
Yeah, no, that's what most practitioners, at least I hope most practitioners, I for sure err on the side of caution during pregnancy, where gentle nourishment, and that's what we see from our foundational standpoint, women really need during this time, more so than those moving, crazy treatments. Because a lot of times women during this time just need like that nervous system reset to help relax the muscles and less of that like very like triggering needle into the muscle. And acupuncturists do similar work along like muscles that are in pain, and we call those Osher points or painful area points. But with those needles, we again kind of tried, like you, try to avoid them during pregnancy.
Yeah. I always explain to people that uh, that acupuncture follows more of an Eastern philosophy that deals more with energetic flow,
Yeah.
whereas I'm just musculoskeletal here. And yeah, so do you have any thoughts on dry needling? Just out of curiosity?
Very interesting. So now in school, we're taught something called motor entry point needling, which is similar to dry needling. It's where the motor nerve goes into the muscle. So we try to hit a needle into that to reset the muscle. So similar to dry needling, and I'm a big advocate for it during with certain patients. There's certain patients that I'll do it to, and they're like, nope, that's really me. That's stick with traditional acupuncture needles. And some patients come in and request it on the spot. They're like, get those needles in. So I think it depends on the patient, but I'm an advocate. Yeah, I think the more people that can be benefited from dry needling, acupuncture, the better. I mean, we both want people out of pain and people feeling better.
Yeah. So speaking of specific points,
Yeah.
are there any particular points or treatments that you often use for things like nausea, sleep issues, pelvic pain, nervous system support during pregnancy?
Yeah, that's a great question. So, similar to any other time in treatment with Chinese medicine, we look at acupuncture or pregnancy and symptoms of pregnancy as like what's going on at the root. So, two patients could come in with the same exact symptom, but it could be from two very different root causes. So, we'll treat those using specific points, but there are specific points that are best for tonifying or sedating an organ, moving energy, helping to calm the shen or what we call like the mind in Chinese medicine. One really good point that people probably have heard a lot about of is called PC6, pericardium 6, and it is right by the wrist here. Oh, I'll show it right here,
Okay.
right in this area in the wrist. And you'll see people wear seasickness bands sometimes, and it stimulates this point, this acupuncture point, which is known to help reduce nausea. So a lot of times in pregnancy, when we see morning sickness in the first trimester, or if it extends into other trimesters, needles will be inserted into this point to help reduce the morning sickness. But I think that research that has come out that's very interesting is how to reduce pain during labor, which I think every woman would want to hear about. And there are 2 points that have been documented, and there needs to be more research similar to what you were saying about like dry needling during pregnancy. There needs to be a lot more research done about this in order to truly understand how it works, if it's working. But so far, the research shows that against sham acupuncture or no treatment, no acupuncture at all, stimulating 2 acupuncture points have been really effective at reducing pain compared to no treatment at all. So that's going to be Li4, which is right here. That's the same point I talked about earlier that was a forbidden point. But now during labor, it's something that a partner could use acupressure on where they just help continuously stimulate. Or if you have an acupuncturist in your toolbox and they're willing to be at the birth with you, that's something they could use needles in, as well as another point, just 4 fingers above the ankle called spleen 6. And that's another point that's just really good at moving blood and has been found to help reduce labor pain.
The inside or the outside of the ankle?
Inside of the ankle. So it's going to be just above that medial malleolus there.
Okay. So that's interesting. So those points you can actually just apply pressure, is that less effective than needles, or are they interchangeable?
Yeah, so acupressure, from my experience, and maybe others will have a different experience, is a little less powerful than stimulating needle into body, but still effective. And the research that I saw talked more about acupressure being the effect because most people don't have access to an acupuncturist. So yeah, it seems like that acupressure alone has been really effective at reducing pain.
Okay. So we talked about pregnancy, postpartum. Can we go back before this journey starts into fertility a little bit?
Yeah.
So when we see somebody, when you see somebody who, let's say, has been struggling to get pregnant for, let's say, 6 months, a year, what could be some benefits that acupuncture could offer?
Yeah, that's a great question. So, for a few things, I love, again, integrative approach. I really like to work with fertility doctors, so reproductive endocrinologist, for a few reasons. One, we want to know if there's anything going on a like more root cause basis. So, is there a patient with endo, with PCOS, even with some nutrient deficiencies? We see people with high TSH or thyroid conditions. We see people with iron deficiencies. All of this can lead to fertility issues. So, one, working with blood work and Western medicine is something I love to do. And then from there, really working to help one. We talk about working from that root cause. So what's going on at the root? Is there a blood deficiency? Is there a kidney essence deficiency? Kidney essence, what helps to build a future fetus? Is there a lot of emotional stress that's causing difficulties with fertility? And we see that in Western medicine too. People with higher levels of cortisol, more stress, can end up having lower fertility rates because of it. So, can we work at a nervous system level through acupuncture? Absolutely. Can we work to help with hormones? Absolutely. We found that acupuncture can benefit estrogen, progesterone. It can help decrease cortisol. So there's a lot of things that we can do to help with fertility. And like I said, I always like to work through an integrative approach. So if we can work with the Western medical system too, in this sense, absolutely. I think that's great.
Yeah, it's interesting. I mean, you mentioned stress, and right, I would imagine that somebody that's been, or a couple that's been trying for a prolonged period of time without success, that kind of leads to this sort of tornado of stress around this topic, and um, like, how many stories do we hear when they give up and
Yeah.
then sort of get pregnant? But it's easier said than done. It's the same as people saying, oh, it'll happen when you least expect it. Yeah, good luck not expecting it when you want it so bad. But it's wonderful that acupuncture is a tool to kind of help reset that system, to give you a little bit of like a nudge in the direction of relaxing around this issue, or maybe in general, right?
Yeah, definitely. I mean, we even look, so what's very interesting is the vagus nerve. We know the nerve kind of touches every single organ, every single part of our body. But what we have also found that it comes and a part of the body that it innervates is right in this inner ear. Now, a lot of times, this is just like the wild acupuncture, traditional Chinese medicine connection. A lot of times when we're talking about female reproductive hormones, we talk about needling through the inner ear here. So thousands of years ago, Chinese medical practitioners and scholars figured out that this part of the ear is related to hormones. And then now, later in the future, where we are now, we know that that's part of that vagus nerve, which has a lot to do with the stress response. So it's kind of interesting how those two things pair up, even from like thousands of years ago to now.
That's fascinating. I didn't
Oh,
know that actually. Yeah. So for women who might be new, or people in general who might be new to acupuncture, what does a typical session look like? And how often do you recommend they come during pregnancy and postpartum, or even for fertility, if you want to talk about that?
yeah. Okay. So we'll start in the very beginning. Let's start with fertility. So a lot of times with fertility, we want at least 3 to 6 months to really see hormones change. And this is pretty normal across the board when we work through holistic medicine, whether it be functional medicine or acupuncture or other modalities. And that would be more like along the lines of a weekly or every other week treatment. And then going into more pregnancy care, I always like to tell my patients, let's get you through the first trimester. Let's give you like a little bit more space from acupuncture during the second, and then let's ramp up care again during the third trimester. So try to get us through the first. A lot of times things are changing, and this is when I see patients experience most symptoms. And I don't know if that for you, you see the same thing. And then second trimester people are usually like, I'm feeling pretty good. They have a lot going on between baby showers and life events. And so I say, okay, take your little rest. And then third trimester comes along and people are like, get this baby out of me. So then we start to ramp up care again and do some labor prep. And then during this period of pregnancy, when we do care, you would expect to have a little bit of a modified treatment in the sense that we aren't going to do some specific points. Oftentimes, we'll keep you on one side instead of doing what we call a flip treatment, where you go face down and face up, just because it's a little less physically possible. But same type of care, a lot of integrative massage and moxibustion and cupping if needed, as well as acupuncture. And then postpartum care is going to be a lot of nourishment, a lot of trying to get the body back to generating that blood and chi. A lot of times we'll use food therapy instead of herbs or herbs, just to err on the side of caution with mothers who are breastfeeding, because we don't always, there's more research coming out that shows how herbs come into the breast milk and how those play a role in the baby. So
Mhm.
at least for me, I like to kind of err on the side of caution, especially looking into the research first. And then from there, we kind of continue treatment until the mother feels good again. And then we go on to like less regular treatment. So maybe once a month as kind of continuous care for the mother after gotten out of the initial postpartum period.
Fantastic.
Yeah.
So, what advice would you give to expectant or new mothers who want to integrate acupuncture and Chinese medicine into their overall wellness plan?
Yeah, great question. So I would say that taking care of yourself is taking care of the baby during that time. So just always remembering the oxygen mask analogy. It's really the truth. I mean, the resources that you have in your body and how you can show up for yourself is going to affect how you show up for your child. So I know oftentimes during this postpartum period, mothers just want to pour everything into their child. It's just a very natural response, but making sure that you look in the mirror and think like I'm worthy of that care too, and in helping me I help this baby in front of me. So I would say my biggest thing I would tell mothers, and I tell mothers, is like remember to pour into yourself a little bit or a lot of it.
Yeah, fantastic. Thank you so much. I think this is so helpful, and I hope that a lot of people get, inspired to come and see an acupuncturist during this phase of life.
Yeah, thank you so much, and thank you so much for having me on. This is great and you're great. So yeah, I look forward to many inter or integrative patients together.
Yeah, yeah, we'll definitely have to do this again. I'm sure there's a million other topics that we can cover.
See you soon.
Okay, bye-bye. Thank you so much to Madelyn Mans for joining me today and sharing her wisdom on fertility, pregnancy, and postpartum care. Her insights bring so much clarity, support, and hope to women navigating these transformative seasons of life. And as always, thank you to everyone tuning in to Sage Connections. If you enjoyed today's episode, please subscribe, share it with a friend, and leave a review. It helps us grow this community and reach more people with these important conversations. Until next time, take care of your health and your wellness.